Good morning, everyone, and thank you for joining us for our monthly COVID-19 Empower Hour here at African Services Committee. If you're joining us here for the first time, the COVID-19 Empower Hour is a monthly discussion on COVID-19 related topics where we talk about how to keep yourself safe from COVID-19, how the COVID-19 vaccines work, information about the boosters, common COVID-19 myths, and where we also answer any questions that members of the community may have. So you can call in, ask your question, and we can also interact with you that way. My name is Kenneth Cruz, and I'm a community health worker here at African Services Committee, and I'll be hosting this month's May English session. For those of you who might be new to the series, I'd like to introduce African Services Committee, what we do in the community, and what we have to offer you in terms of resources. But before that, if you prefer French or Spanish for the language, we will be hosting the French session on May 25th and the Spanish session on May 27th. We will also, in addition to that, be hosting sessions in Bambara and Wolof on May 31st and June 1st, respectively. So African Services Committee, who are we? African Services Committee is a multi-service human rights agency in Harlem dedicated to assisting immigrants, refugees, and asylees from across the African diaspora. We provide free and confidential health, housing, legal, social welfare, education, nutrition, and advocacy services, regardless of your immigration status or ability to pay. In addition to that, we also offer now utility aid. So if you have any difficulty paying your utilities, or I think rent arrears as well, you can contact us. And the information to contact us will be shown on the screen later on, but you can contact us and we'll assess your situation and try to help you in the best way that we can. All right. So what resources do we have to offer? The resources that we have to offer at ASC include the following: COVID-19 testing, which is primarily through at-home test kits, rapid antigen test kits. For the availability of these test kits, you want to call the number that's on the screen, 212-222-3882, to check to see if you have available test kits. And you can also call or text the ASC COVID-19 helpline at the number that's under that, so 1706-502-9163 in English and French. If you have any questions related to COVID-19, the test kits, whether or not your symptoms could qualify in getting a test kit, just simple questions like that. For Spanish, so for our Spanish speakers who have questions related to COVID-19, please call 1-862-248-2864. And these numbers you can also text or leave a voicemail and we'll get back to you that way. Replies will be sent on Mondays through Fridays from 1 to 4 p.m. So just be aware of that when you're contacting us. And if you have any questions that are related specifically to COVID-19 vaccination, you can contact our HRSA team, who is in charge of that, at 1-862-248-2864, or feel free to shoot us an email at covidvaxoutreach@africanservices.org. We also offer vaccination services. So ASC helps clients to make a vaccine appointment by using their client zip code. And these vaccine appointments can be made for any shot. So it could be your first shot of the COVID-19 vaccine, the second dose, or even for booster doses, first and second, and we'll get into that a little bit later. But basically what we do is we take the zip code that you shared with us and we'll work to find an accessible location to have the vaccine administered to you. And that location would ideally be close to that zip code. So in almost all cases, that tends to be relatively close to that zip code, but in cases that it's not, we can also set up at-home vaccine appointments where somebody from the Department of Health, usually a nurse or a health worker of some kind, comes and gives you the vaccine dose in the comfort of your own home. So that's also an option that's available. We also host free COVID-19 vaccine events at our office. So we partner with local community organizations to offer vaccines free of charge and regardless of immigration status to the local community. These vaccines include the Pfizer, the Johnson & Johnson, and the Moderna vaccines. And again, they're for any vaccine dose, so for the first, the second, and booster doses. And we're also including the doses for children as well. So it's not just adults, but also for children. And to remind everybody that the Pfizer vaccine is available for children ages 5 and up. In these events, we also have health workers, healthcare practitioners who can provide blood pressure screening and depression screening. So if that's something else that you're also interested in, and that's also free of charge, feel free to come to these events. We typically broadcast them on our social media, and the month that we'll be having them is when you'll see that information. For vaccination, there's some more information that you should know. So clients are now eligible for a second booster 4 months after their initial booster dose. And that's for anybody who falls in one of these 3 categories. So if you're 50 years of age or up, you are eligible for a second booster 4 months after your initial booster dose. If you are 12 years old and up and are moderate or severely immunocompromised, you are also eligible for a second booster dose. In the case of somebody who is 12 years old and is experiencing moderate or severely immunocompromisation, it is recommended to take the mRNA vaccine dose for the second booster. And for individuals who are between the ages of 18 and 49 years of age, who receive the Johnson & Johnson vaccines for the first vaccine series and for the first booster dose, it is also recommended to take the mRNA vaccine dose for the second booster. So if you are between 18 and 49 and you got the Johnson & Johnson for the first dose, great. For the booster dose, you also got Johnson & Johnson. For your second booster, you might want to think about taking a Pfizer or Moderna vaccine dose. And that's the same case for somebody who's 12 years old or up and is experiencing moderate or severely immunocompromised situation. It's recommended to take a Pfizer or Moderna vaccine dose for their second booster. We are also offering, or I guess the vaccine booster is also being offered for children who are between the ages of 5 and 11, 5 months after their first vaccine series. So if you have children who are between those ages and are 5 months out from their primary vaccine series, so they already had their first dose or the first dose in the Johnson & Johnson vaccine series, or the first and second dose, then you can be also looking at booster doses for them. And it's recommended now with this current recent surge in COVID cases, which I'll also address later on. So some more COVID-19 news, and as I was kind of getting to it already, some changes into how COVID-19 is being spread in New York. There is a change in our COVID-19 alert level. So I want to talk about what that means for New Yorkers and how you can protect yourselves. So there's been a recent change from the COVID-19 alert level in New York City. It was originally being 3 weeks ago at medium, and now it's currently at high. So to explain what that is, basically the alert level is assessed depending on the level of COVID-19 cases. So if they're rising, then it's going to, it's a factor that they consider when changing the alert level. They also consider COVID-19 hospitalization. So how many people are hospitalized because with COVID-19 cases, and hospital occupancy. So how much of the hospital beds are being used or occupied by COVID-19 patients. So as you can see, COVID-19 cases are rising in New York City. This information is as of May 11th, but I checked the information this morning and it's very, very similar. So around 4,080 cases in the last 7 days of COVID. And that represents nearly tenfold rise in cases that we were seeing a month ago. COVID-19 hospitalizations are rising. So a month ago, it was 8 people admitted to hospital in the last 7 days with COVID-19. Now it's 70 people admitted to the hospital with COVID-19 in the last 7 days. And hospital occupancy is rising. So around 4.6% of inpatient hospital beds. So hospital beds that somebody can get if they're required to stay in the hospital for whatever reason. 4.6% of those beds available are occupied by COVID-19 patients. So with all these factors together, just is pointing to a high community spread. So there is a higher level of spread of COVID-19 in New York City at the moment. Again, what does this mean for you? So the Department of Health's guidance during this high alert level is the following. So you want to stay up to date with your available vaccines. That means getting vaccinated and boosted if eligible. So I went over that earlier. Whether you're getting your booster, your first booster or your second booster, you want to get vaccinated and boosted. And in addition to that, you want to wear a high quality face mask in public indoor settings. So consider upgrading to higher quality masks if you haven't done so already. These include the KN95s, the KF94s, and the N95s. If those masks are unavailable to you or out of reach, you can also use kind of a layering method. So use a cloth mask on top of the surgical mask. You also want to get tested frequently. So if you suspect that somebody in your vicinity, in your social group had COVID or was sick, or if you were in a public indoor setting where was a lot of crowding people, then that's definitely something to consider before getting tested for COVID. And lastly, you want to isolate at home if you've been recently exposed or if sick. So if somebody has definitely tested positive for COVID, who you've been hanging around, you've been in a social setting with, you want to isolate at home just to prevent any further transmission of COVID, especially if you have any symptoms. So how can we better protect ourselves during this high COVID-19 alert level? Well, there's a couple options. So first, if you believe you've been exposed, you can pick up free at-home rapid antigen tests at New York City museums, libraries, and even African Services Committee. So if you're picking them up at a museum or a library, they're usually in the front. They're offered to you at no charge. And at African Services Committee, we also offer at no charge. You just have to call beforehand just to make sure that we have enough of them available to distribute. Per the New York City Department of Health, everyone can receive 2 sets of 4 free at-home rapid antigen tests by mail as well. So, and this is available to anybody who lives in the US, regardless of immigration status. So if you prefer to have them mailed to you, you can visit covidtest.gov, or you can call 800-232-0233. For those of you who are concerned about what to do if you test positive for COVID-19, these are the resources that are going to stand out to you. So it's 2 primary resources. The first is Test to Treat. So there is a federal website that finds locations in your area that provide free COVID-19 treatment, including antiviral treatment. So essentially what they'll do is it'll be a location that usually has the capability of assessing you. So they'll assess you to see what symptoms you have. And then if they think that providing antiviral treatment is warranted, they'll provide it to you then and there. There's locations that only have the capability of assessing you, and there's locations that only have the capability of prescribing that treatment for you and giving it to you. And there's locations that include everything. So just be aware of that when you're using the website to find a location near you. So all you do is go to the website, provide your zip code, and it locates somewhere that's close to you. In addition to that, New York City has the capability of connecting you with a provider, a healthcare provider. So for a call provider, New York City can connect you with a healthcare provider who can help determine what kind of treatment is best for you, what kind of treatment you need, including antiviral treatment. So you get on the phone, you'll call the number that's on the screen, 212 COVID-19, which is 212-268-4319, and they'll, at some point in time, it doesn't take too long, connect you with a healthcare provider. First, they'll screen you, asking you a couple questions about how you feel and what symptoms you're experiencing, and then they'll connect you to somebody afterwards who has the capability of prescribing, if necessary, antiviral treatment. And that treatment is usually Paxlovid or some other antiviral for COVID that now exists. At this point, if you have any questions, you can submit your questions and comments in the Q&A box, and we'll get to them. And it can be about anything related to what I just talked about. I know it's a lot of information, or it could be anything related to COVID-19 vaccines in general, or just COVID-19. So I just wanted to give everybody the opportunity to submit those questions and comments down. And then if there aren't any questions, then check. And that might wrap it up. But there was something that I did want to clarify. So for antiviral treatment, if you have been assessed to need antiviral treatment, I want to clarify what that is. So I mentioned one of the antiviral treatments they provide is Paxlovid, and that's something that you want to discuss with a healthcare provider if you're using a New York City resource or you're connecting to your PCP. They can discuss that option with you to see if it's right with you, because there's some contraindications, which means there's some instances where it's probably best not to use it. So for people with certain health conditions, it might not be the best option for them. So definitely want to talk to some kind of healthcare provider, whether it be a healthcare provider provided by New York City for free, or with your own primary care provider who can also prescribe that treatment. But it's a treatment that has emergency FDA approval. And the idea is that you take it for 5 days, and it's supposed to help prevent serious hospitalization and the transition to a more grave COVID case. Again, it's more complex than that. So definitely something you want to discuss instead of expecting to be prescribed that, because it might not be the best option for everyone. So consider your health condition, talk to your healthcare provider about Paxlovid or antiviral treatment, and just go in there informed so that all options can be considered if you're concerned about COVID-19. I don't think there's any questions, so that'll be it. We have our next COVID-19 Empower Hours on June 21st in English. Actually, the first one in June will technically be the African language is Empower Hours, the ones that I talked about earlier. So June 1st, stick around for that. But for the next English session, it would be June 21st. The one in French is the 22nd of June, and then the one in Spanish is the 24th of June. So join us next month, where we'll talk about the next updates in COVID-19, if there are any updates, COVID information as it comes out, and we'll update you with any change in guidances regarding COVID-19 vaccines or COVID-19 in general. Thank you so much, and I'll see you next month.